Welcome back to Scots Take. I'm your host, Patrick Curry. Today I'm joined with softball player Karliegh. How are you feeling?
I'm good. How are you?
Doing pretty good. Glad to be back. So you've been named Player of the Week twice this season. What does that mean to you?
It's a pretty big honor. I didn't really expect any accomplishments like that this season, but being a senior, I told myself I wanted to go in and play loose and just have fun.
So kind of just going into that, what mental preparations or pregame rituals do you stick to make sure that you're, playing at the level you want to play at?
Honestly, I just text my dad, talk to my dad, and he just always reminds me to stay calm and do what I do.
How have you, dealt with, some of the changes that have come from the team this season with having a new coach?
This year we told each other we were just going to keep it simple, stick to our fundamentals, and go out every game and play with heart. So.
And, just speaking on that topic of change, I saw that you switched from outfield to infield. Mm-hmm. What has that been like for you?
It wasn't that big of a change because when I played travel ball in high school, I played infield. So, it wasn't too big of a change.
And so what do you think about the team identity? What kind of separates you guys from other teams? What makes this team special?
I think just the fact that we have faced a lot of adversity and we have had a lot of coaching changes, and to be able to come back this season and do pretty well in conference compared to past years, it's pretty big for us.
And, you guys are 6-6 right now. What's kind of the mindset or approach moving forward in conference play?
Come out, play hard, and win. Yeah.
And so what are your, overall goals for, a successful season? What would a successful season look like to you?
Making it to the conference tournament, because I don't think we've done that since 2019, 2018. So, yeah.
Thank you, Karliegh, for joining us today. It was a pleasure having you on the show. Coming up next, we have Bob and Callie in the trainer's room telling us about their day-to-day life. All right, so what got both of you into, wanting to be athletic trainers?
I can go first. I have always wanted to do this probably since junior high. I had to write a paper, and I chose athletic trainer because I was always involved with sports, and then I also enjoyed some anatomy and phys classes, so I kind of wanted to combine both of the two genres together. So sports medicine has been something I've always been interested in. Always done sports. So.
How about you?
Yeah, so I just had an injury in high school, and when I went to the doctor, they sent me for physical therapy. My physical therapy was with an athletic trainer, and I kind of saw the things he did, and it just kind of led to more interest. And eventually, when I had to do an interview in college, I interviewed that same guy that I had in high school. So it just kind of progressed that way.
Yeah, so is this something you guys kind of, from that moment forward, you kind of knew this is what you want to do, and there's no really, questions on, oh, I'm not sure, or was there
a little bit of a question? I definitively thought physical therapy might be another option, and then the further I got into the academic part of it, athletic training was going to be more of my option as far as my GPA kind of dictated that a little bit. But I'd say in the overall perspective of things, it's similar, not exactly the same. Obviously the sports component comes in quite a bit with athletic training, and I definitively enjoy that quite a bit. So.
Yep, when I was in college and I was in the athletic training program, there was some questions where I was like, oh my gosh, do I really want to do this? But there was some opportunities that they told us that athletic trainers could kind of branch out and do the PT world, or you could do the college setting and stuff like that, or you could do it in a workplace in a factory too, working with regular people, not just athletes too. So we were able to branch out a little bit, so I didn't feel like I was so put into a narrow road. It shot out a little bit, so there was other opportunities out there for jobs.
So what do you guys think is your favorite or just best part of the job?
Me, it's working with the athletes. I enjoy the college athletes. I used to work at a PT clinic where the population was more elderly people, which was fine, great, all that stuff, but at the end of the day, I missed my sports and working with the athletes and getting them back.
What was that transition kind of like for you, going from working with the elderly to working with college athletes?
It's a lot of patience with the older people. Normally you get a patient at a PT clinic and you're working with them for 30 minutes, but you're only doing 5 or 6 exercises. So they don't have the stamina, they really can't do a whole lot of repetitions, and it's a lot of just range of motion stuff for them. And I like the whole atmosphere of the injury with the athlete getting them back, seeing them perform. So yeah, that's why I'm here. I like this place a little bit better.
How about you, Bob?
That's a really good answer because that's exactly what I would say. You know, I like the interaction with the athlete. Definitively in the physical therapy world, when you're dealing with the older population or other components of that, it definitively feels different than what we do here, for sure. And I enjoy the competitive aspect. I like a little bit of pressure, that type of stuff. All kind of lends myself more towards the athletic training side of things, for sure. But I enjoy that a ton. Okay,
and as far as, you know, recovery goes within athletics, how much do you guys think like a mental aspect plays a role in an athlete's recovery?
Oh, it plays a big part. Big part. We are sometimes the athlete's therapist too, because we have to talk them through this because they're so down, they're so used to, like, if they get a major injury where they have to get surgery like an ACL, like there's a whole part of just mentally preparing them and getting them to the realization that, you know, this is going to be slow, this isn't going to be as fast as you're used to, like it's not going to be quick, this is a long recovery, and we have to be there to support them down that whole road and that path.
I totally agree. I think it's one of those things where the recovery is vital, and for us, it's giving them the education and the information that helps them do that quicker and be more successful faster, and that they're back on the field or they feel better much quicker than if they didn't have us. I think that's the biggest thing we can offer is the educational part of, you know, let's try this and see how that works for you and that type of stuff. And again, it's our job to come up with those protocols and things to get the athlete back and feeling better much quicker.
And we're part of their day. Like we see them almost every day.
Yeah, so I can definitely attest to that. You know, just going through injuries and just being in here all the time. What's that sort of like? You know, just the relationship with the athletes.
That's one of my favorite parts of being here is the relationship that I get with people, and then it lasts not just when you guys are just here for 4 years. Like they come back and they remember you and you reminisce and stuff like that. Yeah, I enjoy that part of it.
Callie's getting all the good first
Sorry,
answers.
I'll let you go first.
That's exactly what I would say too. The relationships are super important. I think one of the things that's nice about a small school, I went to a bigger school, and if I went back to Eastern now, I wouldn't know anybody. But you know, I think one of the bigger things that we can offer at a small school is a personal relationship, and that when you talk to somebody, you're talking to somebody you know, and I think that creates a different feel for the person, and it creates a different feel for me. Like when I have a relationship with somebody, I treat them different. Like I give them a little different type of daily interaction and things like that. So huge as far as I'm concerned is that we provide that personal relationship, so that when you're dealing with an injury, it's not just, you know, so business like. It's got a little bit of a feel of like this person cares and
they're comfortable.
Yeah, they're comfortable. Yeah, I agree 100%.
Yeah, and what kind of advice would you guys give, just in general, for prevention of injuries or, you know, those recurring problems?
Thanks for letting me go
You
first.
go first.
Strength is probably the biggest thing. Like the one thing we would see is that the person who isn't strong enough or has a weakness, and it might not even be something that they're aware of, that causes an issue, or we get somebody who's not maybe used to the workouts that we do, and we have you know, a tougher one, and then they're tight afterwards, and the stretching is another big part. You have to have the movement of the body part to kind of prevent something from occurring. And if they're not quite used to that, and they're used to their high school setup, and it's maybe just a little bit different, and that can be tougher to recover. So for us, it's that same, it goes back to the recovery and giving them the information about how do we recover so that we prevent something from occurring. And then that component goes along with looking at some things and saying, maybe we have a little bit of weakness here, we're obviously having an issue, and then how do we do that through the training room, into the weight room, and for that full recovery.
It's a multi-step thing. You can't just focus on the injury itself. We got to figure out why this is happening and what we need to do to change it.
Okay. Well, I just want to thank both of you, you know, for taking the time to talk with me, and not only that, but just, being there with me throughout my 4-year career and helping me pretty much on a daily basis recover as an athlete.
It's our pleasure to
Yeah.
sit down with you, Pat.
Love it.
Enjoyed it.
Thank you. That's all for this week's episode of Scott's Take. Come join us next week where we have tennis player Natalie Lebicki on.